All right, today we're going to be talking about lasers. This is a modality that we don't see very often. It's becoming more and more popular, so I think that you're going to come across it more often in clinicals and practices. So let's start. What is light therapy, or it's called phototherapy? Comes in different ways. Lasers, which is the one we'll be talking about today. You can also find light therapy emitted by light-emitting diodes, or LEDs, superluminous diodes, fluorescent lamps, infrared light, and ultraviolet or UV light. But let's talk about laser, which is a light amplification by stimulated emission of radiation. A laser is a device that controls the way that energized atoms release photons. Specific wavelengths of laser light, when absorbed, will then cause specific physiological responses in the body. That's a good general statement for what's going on with lasers, why we're using them, because our body reacts to light in a positive way. Light laser is unique in that it's monochromatic, so one color, monophasic, it's coherent, so we can be treating really small areas, and it's non-divergent. Like a flashlight, the light actually diverges out into a cone shape. Laser stays streamlined. History of lasers. Sunlight therapy had been used to improve health for centuries, and then solariums were built by the Greeks and the Romans for that purpose. And in the 1960s, lasers were used to remove cancerous lesions, and accidentally they found out that they healed incisions. Of course, there's different classes of lasers. We've heard of all sorts of lasers, so laser pointers and laser printers. And so we have them in different classes. The ones that we're utilizing are class 3B therapeutic lasers. If we get into class 4, there's our hot lasers and our surgical lasers used obviously for cutting. So we have hot lasers. And cold lasers is another way that we could classify them. Hot laser is a surgical laser used to cut and destroy tissue. It's a class 4 laser, and it generates greater than 500 milliwatts of power. A cold laser does not destroy tissue because it doesn't generate heat, and it's less than 500 milliwatts of power. What would be the indications for us to use lasers in therapy? Primarily, it's wound and tissue healing. However, there have been a lot of studies coming forth saying that it relieves pain, specifically to wounds, carpal tunnel syndrome, and epicondylitis. Now, the others listed there have been studies done saying that they could decrease pain in these situations, but they're not conclusive, and most of the evidence, most of the studies have been done on carpal tunnel and epicondylitis. Contraindications for using or where to use lasers, of course, not in the eyes, not over the uterus during pregnancy, not over cancerous area. If somebody is taking a medication that makes their skin photosensitive, tetracycline is one that we often see, younger population taking, then we shouldn't be using laser over that. Over a thyroid gland or endocrine glands, and then over a hemorrhage. Well, what are the effects of lasers? Primarily, it's to promote ATP production, and that is used for wound healing. And along with that, we get it promotes collagen production, controls inflammation, it inhibits bacterial growth, promotes vasodilation, and increases nerve conduction velocity and regeneration. It's all really good things. What's the mechanism of action? Well, photons are absorbed by photoreceptors in the tissue cell, causing a change in the photoreceptor's molecular configuration and alters the cell's molecular process. And that's all in a positive way, therefore assisting in healing. Once the cells are stimulated to produce an enzyme with the low-level laser therapy, the adjacent cells are stimulated by the presence of this newly produced enzyme to also produce the same chemical effect, effectively duplicating and enlarging the effects of light stimulation. So a little bit of a domino effect around the area that you're treating. The enzymes produced are also those that are naturally produced and used by the cells, so it's not a chemical, it's not changing, and there's very few side effects. So let's go inside of an atom and hopefully understand a little bit better of what's going on. So in this we have a nucleus in our atom, here purple, and the electrons are all moving in their specific orbits around this. And they can be in different, what we call states of excitation. And if we apply energy or heat, or light, like we would, or heat, which we would with lasers, to an atom, the electrons will transition into a higher orbit. So if we apply a little bit of heat to an atom, this electron will hop up into an orbit further away from the nucleus. Now, as the electron, what we call relaxes, and this moves back to its original orbit, as it moves back, there's a release of energy, and that is in the form of light, and we call that a photon. If we look in the laser tube, all right, this is kind of what's going on. There's typically a gas inside of here, a specific gas with specific atoms to that gas. So in this picture, our little purple balls are atoms. We've got a mirrored surface here and what we call a half mirrored or partially mirrored surface on the other side, and this gas with the atoms moving around in it. We apply heat, all right, with this up here, and when that heat is applied, then the electrons move and to a more excited state, and then as they relax back down, then we get a release of the photons. So that's the green balls are the emitted light, or the photons that are being emitted as the electrons come back down to their orbit. Now some of these photons are going to hit the mirrors on the ends, and then they start to bounce back and forth, and eventually they bounce back and forth, and they're going to come to this area that is half slivered, or we got a little sliver, and the light can come out. All right, so the photons are coming out of this escape door on the end, and that's what we see as laser light. And then that light is used to treat a specific area. Well, how does light even affect healing? Well, every cell in the body has light-sensitive chemicals called cytochromes, and the chemicals are located in energy compartments in the cell called a mitochondria. So we have, if you remember, our mitochondria are kind of our energy warehouses. So when you stimulate the cytochromes with the correct wavelength and power of light, it provides the cell with extra energy, and that energy is used for growth, regeneration, or healing of the cells. The biochemical reaction also increases the production of ATP, which initiates vasodilation in cells to bring oxygen-rich blood into the injured area. So in summary, we have measurable effects of low-level light therapy that appear in the calcium ion channels, RNA, the DNA. We see different in the increase in production of proteins, fibroblasts, lymphocytes, and leukocytes, all, of course, lending themselves to the healing of the cell that is injured. Low-level light therapy does not damage the skin. It's non-invasive, has no known side effects when used properly. All right, so this gas inside of the laser oftentimes is helium neon, which has a wavelength of 632.8 nanometers and appears red. The depth of penetration is only 2 to 5 millimeters, so you can see why we use lasers primarily for superficial or skin wounds or healing. Gallium arsenide has a wavelength of 904 nanometers. It appears as infrared, and the depth of penetration of that is potentially 1 centimeter, which would be more effective than to deeper tissues. As far as setting up parameters, or the parameters for laser therapy, one thing you need to remember is to stay in close contact with the skin, or close as possible, without touching if it's an open wound. The dosage is figured by this equation that you have here. However, usually this is all calculated in the machine. The machine comes with a specific dosage. It knows the power, and so you'll put in a treatment area, or you look this up on a chart, and what you're looking for is the time. So the equation you'll be solving for time. So the parameter depends on output power, the time of light exposure, and the size of the treatment area. Again, when we use these in lab, you'll see that it's actually quite easy because most of the calculation is done for you. The longer the wavelength, the deeper the tissue that is treated. So infrared is for deep tissues because it has a long wavelength. And then red is more shallow. And then blue, even more so, we have open skin wounds. The dosage is measured in joules or watts per second. Wound healing typically is 4 to 5 joules is administered. Pain management, 6 to 12 joules. There's lots of recommendations in the textbook, and then the owner manual usually comes with some as well. I don't know that I have this on here. I don't. But remember, too, under application, you need to write in there to wear eye protection because you shouldn't be looking into the light. So we're going to use firm pressure perpendicular to the tissue over clean skin, and we'll have cleaned the applicator head prior as well. There's 2 different methods of probes. We have a single laser probe and the cluster probe. Here's the single laser probe that we can use with the grid method. So you can actually draw a small grid, and the boxes should be about the size of the end where the light is emitted. Or you can scan over the area, just scanning back and forth in kind of a grid-like fashion in the small area being treated. Remember, however, this picture is not a good one because the unit should be held perpendicular to the tissue, so you shouldn't be seeing this much light through your colored protective glasses. Cluster probe is a combination of laser diodes that affect deep tissue, superluminous diodes, which affect a little less deep tissue, and LEDs are light-emitting diodes for most superficial tissues. So tissues at different depths being treated with a cluster probe and are becoming much more popular. Point of interest, make sure that both you and the patient are wearing protective goggles, that skin color, water content, and hemoglobin content all affect the absorption of laser light. It's safe to use over pins, metal plates, implants, growth plates, and pacemakers. It does not treat through clothing. It needs to be in direct contact with the skin. Use 50 to 70% of the recommended dosage when treating over a dark tattoo or dark pigmented skin. Typical treatment time is 3 times a week for 8 to 10 treatments, and you should see changes in a week or less. If not, then you might entertain trying a different tool for what you're doing. Comparing laser to diathermy. Diathermy is an electromagnetic therapy, and laser is considered an electromagnetic therapy. Diathermy will create deep heat. Laser creates no heat. Diathermy treats deep tissues, and lasers treat superficial tissues. Diathermy, we can't see the waves, and with laser, the waves are definitely visible. The next few slides I'm not going to read, but I do want you to read through them so that you can see some of the differences now between laser therapy, electric stim, and ultrasound. So I'm not going to comment on them. You can just read through these. Pause the video if you need to. And that's all we have for laser therapy.